Today I wanted to talk about keto and your body type. When I put this program together, I wanted to make sure that it was specifically for women. Years ago, when I went to train with Dr. Berg, he has a book, and you probably have seen it. It was one of the best sellers, and he actually has a new book now. And this is what the old book looks like. Well, this is what it is. It's called The 7 Principles of Fat Burning, and we went and shadowed him and spent some time at his clinic to see really how that tied in with what I was learning with functional medicine. And it was based on the 4 different body types, and the liver, the thyroid, the adrenal, the ovarian, and how you help people with different body types. And it's kind of like having, if you have a German car, you're going to need different brakes than you do for a domestic car, or if you have an Italian car, you need different parts and they run off of different fuel. So what I loved about his book, when I went and trained with him, I really like learning about the different body parts, and it made a lot of sense to me. So we kind of started seeing a lot of patients in our office based on that. And as paleo started coming in, the ketogenic diet started coming in, we started putting all that together and combining them and marrying them. So when I hear about a lot of people, and I was just having a conversation with somebody today about the ketogenic diet, and they were actually more of an adrenal body type, and a lot of the ketogenic diet is lots of dairy and high fat, which a lot of dairy, but this person had some adrenal issues, they had some GI issues, and I was just telling them, no, you can't do dairy. It's not a good thing right now. You're doing high intensity exercise. That's not the smart thing for you to do. And we had to customize a strategy for her. So that's what I want to do today. I want to share, you have a couple of handouts here. One was really trying to figure out, well, which body type am I? There's a checklist here. And then the solution guide here actually has pictures of the body type, the thyroid, liver, and the adrenal and the ovarian. So I'm going to talk a little bit about each one, and then you're going to figure out which one is you. Usually, well, let's start with the first one, the thyroid body type. The thyroid body type usually is the person, they have autoimmune conditions, they have low thyroid, they're on some sort of medication for thyroid, whether it's Synthroid, whether it's levothyroxine, Cytomel, something. They know that their markers have become really low. So that's the thyroid body type. They're tired a lot of the times. Their body just looks really thick, kind of all over. Their legs are thick, their arms are thick, their waist is thick. So they're losing a lot of hair. They're just fatigued, they're depressed, they're really just apathetic. It's just really hard for them to get going. So that type of body type, the thyroid, usually they're a secondary body type. Their lifestyle, which is usually an adrenal, which we're going to talk about in a little bit, created the thyroid body type. So you ask, well, which one do I deal with first? Well, since we're talking about thyroid, let's talk about how do we work with the thyroid. How do you tie this in with the ketogenic type of lifestyle and diet? You definitely want to go, I always say, with this person, of course, higher, you want to go with the high fat. And I think one of the mistakes with the ketogenic diet and the lifestyle is people do too much dairy, and they do the conventional dairy, and also they're eating foods that maybe their body are reactive and having an allergic reaction, so they stay stuck and they don't lose weight. So with the thyroid body type, if you know that you're a thyroid and you have those, you're on medication and so forth, I think a couple strategies that you can do that's going to help you are going to be, one is start cooking your vegetables. So the cruciferous are goitrogens, so they affect your thyroid sometimes in a negative way. Although most of the studies and the research show that you have to have a large quantity. However, people with it's more of a mental thing. So I'm like, okay, well then just cook it or steam it or stir fry it, and that way you don't really have to worry. But you really have to have a large amount. So I would recommend that they would do more of a I would say start with higher vegetables. We have here that it's lower fat intake, transitioning into a higher protein, then a healthier fats, and then going back down into more of the ketogenic lifestyle. So they usually do better at right around between 70 and maybe 90 grams of fat, whereas most of the adrenal, they do better at the higher fats. So that is more of the thyroid body type. I would recommend, as far as exercise for this person, their exercise have to be short and intense, just really short and intense exercises. Be in and out of the gym within 20-30 minutes max. I've made a list here of certain tests that I would include, making sure that a full thyroid panel has been checked, so definitely want to do that. So let's talk about the second one, see if we can cover all 4 of them right now. If not, we'll do it in another video. So the second one is the liver body type. And the liver body type, it's really, this is the person that they have a big belly, but it's super hard. They have ascites. You move the belly sideways and you hear water in there. This is usually the drinker, the person that drinks a lot of alcohol, that's been exposed to a lot of chemicals. They have a lot of those types of issues. They see it. They have a lot of skin tags. They see a lot of it in a lot of issues in their skin. Hair problems, hemorrhoids, acid reflux, constipation. And the liver also has a lot of like shoulder problems because of the radiating pain from the organ of the liver. So they sometimes don't do well. They don't do very well on a higher fat diet. So with the ketogenic diet, they definitely need to have some sort of liver support. That's where the liver products that we recommend and gallbladder are going to be really important, and digestion is everything. So they usually do really well with a lot of higher vegetables, and ketogenic is actually perfect. The lower fat intake is going to be more from animal products, but it's going to be a higher fat intake from like coconut products, avocados, olive oil. Those are the kind of fats that they're going to thrive off, not so much the animal fats like the dairy products. So the dairy and the animal products, they don't do as well. So that is your liver person. So I would suggest, I have recommendations there as far as what other tests you can run. And in the next video, what I'm going to cover is I'm going to cover the adrenal and the ovarian body type. So look out with those, because they're all interconnected, but you are going to feel that you're more of one than the other. And there'll be a combination, and what you'll see, like, you may feel like, well, I'm more of the adrenal thyroid. Okay, well, if you're the adrenal thyroid, then you will probably do better with starting off with the vegetables, as I mentioned, cooked vegetables, and making sure that your exercise is shorter. It's not long exercise, whereas another body type would be. So we're going to get into that, but like I said, this is just for thyroid or liver. So see if you resonate with one or the other. And then the next one, we're going to talk about adrenal and ovarian. So I think most of you are going to fall into adrenal. That's what I have seen the norm has been for a long time. Okay, I'm going to share about the other two in the next video.